my beauties. My name is Dr. Stefani Kappel and I'm a board certified fellowship trained cosmetic dermatologist in Newport Beach, California. And today we are going to be talking about the jawline. The reason why we're going to be talking about the jawline is this is probably the most requested treatment area today. It's getting the most views on social media. It's getting the most inquiries about in office, on social media, in different aesthetic forms. And I just flew in. I literally just put my suitcases down and just came in from the airport, where I was in Las Vegas last weekend with some of Allergan's top injectors, and they're about to launch a new product, Volux, which I actually am going to have my hands on tomorrow, which is super exciting. And I've also been injecting it all this weekend. And the reason why the launch of this new product, Volux, is going to be a game changer is because Allergan as a company are trailblazers. Basically, they ask what the people need, what the people want. And as injectors, an aesthetic and cosmetic dermatologist, a lot of us are saying we need something for jawline contouring, because we definitely have tools in our armamentarium, but we're seeing an increased, awareness and increased requests for jawline contouring and improving the aesthetics of a jawline. So the launch of Volux, which is going to be a new hyaluronic acid-based filler, it just was launched this last weekend, and those of us who attended this very coveted small group of injectors are going to have first access to it. So I'll definitely post content using this new product for the jawline, but I also wanted to do a video just addressing the jawline in and of itself as a treatment area and how we can enhance its appearance, not just by Volux, which is the new kid on the block, the new injectable that's going to help us kind of just really customize and define, sharpen, contour that jawline area, but other things that we have been using and that I've been using in my office for years that has really dramatically improved patients, self-confidence, how they look when they're being filmed and they don't know it, when your friends are taking pictures of you from every angle, from the profile, from the oblique, from head on, and just like a full 180-degree correction of this very important area of the face. So before I move on, I ask that you like and subscribe, leave a comment in the comment section, and I'll definitely try to get back to you in the most timely manner as I can. But you guys have to remember, I'm in the office seeing patients every day, so I may not get back to comments in a very rapid time within the next day or so. But I see you, I hear you, and in the comment section, just leave me comments of also what you want to hear about, because I take those comments and that information, and that's how I decide what to do my next video on. So I'll drop content every Sunday, and just be sure that you like and subscribe and hit the bell so you get notifications every time I post a new video. And I post on shorts as well too. Fun things, BTS in the clinics, me treating my patients, doing cosmetic procedures in the office in real time with real life patients. So hopefully you can join my YouTube family, and we could just share information that's unbiased, not sponsored, and just an exchange of ideas just based on 20 years of training in cosmetic dermatology and in this specialty. I love to share it with everyone, not just patients, but newer injectors too, who are trying to learn and trying to gain training and get educated as well. So for the jawline, the reason why I feel that the jawline is such an important key aesthetic component to the face and facial rejuvenation, or not even rejuvenation, prejuvenation, prevention of changes that happen while we age, or even correction of anatomical deficits that maybe we weren't born with a strong defined jawline, or maybe we have like a hypoplastic chin, or maybe our angle of the mandible isn't as pronounced as our brothers and sisters were, and it's a genetic, it's just a little genetic variation that we can correct easily without surgery. So you don't always need a chin implant, you don't always need liposuction, you don't always need hardware from a plastic surgeon inserted into the jawline. There's minimally invasive procedures that can make a dramatic difference in a very safe and effective and a healthy manner. So before I move on, I want to also mention something that was brought up a lot at this meeting, and there's so many new and exciting treatments coming down the pipeline. Just attending this meeting, I'm going off on a tangent now, so many new approaches to skin changes that happen with age, or just the remodeling structure of the skin, and different hyaluronic acid biostimulatory and HA combined with biostimulatory treatments and injectables that are coming down the pipeline, and new devices, treatments for cellulite. They talked about so many new technologies, and I recently just did a video on new technologies, but here's another one because I just got a whopping dose of new information. I actually was asked to take some of my content down because a lot of this information is proprietary, but I like sharing it with my beauties, my followers, my patients, because I really want to keep you like in my pocket or be like a fly on the wall hearing doctors talk about these new developments and techniques and clinical trials of new and exciting treatments coming down the pipeline. But today we're going to stick with the jawline, which there's plenty of new technology coming to improve the jawline contour, but also again, treatments that we've been doing day in and day out in the office as well. So the jawline is also a really interesting treatment area of the face because unlike, tear troughs or nasolabial folds or marionette lines, it's an area that goes across all genders, or all genders. I guess you could have male, female, gender fluid, transgender, men or women or anywhere in between. Everyone's interested in improving their jawline contour. And this is something that Allergan looked into, and it doesn't really affect one sex more than the other. Like for example, lips were traditionally more, coveted by females, but now we're seeing more males going to lip injections as well. And there's some catch-up time, but with the jawline, men and women equally are very aware of their jawline and improving the cosmesis of their jawline. And there's actually a slight higher interest from among males than females, which is also really exciting. And also it's across all age groups. So whether you're, young, middle of the road, older, or somewhere in between, either you are seeing changes with the jawline as you age, and it was really interesting to hear all this, information, pathophysiologic information that contributes to jawline resorption. We lose actually bone in our jaw as we get older, and it's also directly proportional to estrogen loss, like postmenopausal women who have loss of their jawline contours because they're having bone resorption, and that can be exacerbated after menopause with the loss of estrogen. And in males, increased testosterone can enhance jawline structure, but it can alter the overall cosmesis of the face. So your face doesn't look like it did when you were younger if you're a man, because of changes that happen also with hormone levels that have more to do with testosterone than estrogen. So it's really interesting because as we age, our jawline changes. And even in people who aren't, in their late decades of life, who are younger, may sometimes have not been born with the jawline structure that they had hoped that they had. And so that's why, improving jawline, contour and the aesthetics of it can change. It's not just for old or young or anywhere in between. For sometimes younger patients who want to correct an anatomical deficit or enhance what they already have, or somebody who's older who wants a chin like they used to have. It goes across all ages, both sexes, and it also goes across different races too. So men and women of all ages and races, ethnic backgrounds, all are looking to seek for the perfect jawline. So the jawline's getting a lot of attention now. And I happen to think it's because, we see a lot of different angles of ourselves, on Zoom and on social media, and pictures our friends take of us that we weren't really prepared to take. You're now getting photographed from every angle. And then also, there's a lot of attention, from influencers and people on social media that are kind of like showing off their perfect jawlines as well. And also is because they were covered up with masks for so long. I think now we have an increasing awareness of what our jawlines and our AP profile and our oblique view of ourselves looks like, which we kind of were hiding before for a year or two. So without further ado, I'm going to talk about different jawline enhancement non-surgical options. So the first one, just to kind of keep it simple, the first one is Botox. So Botox is one of the easiest things that you can do to enhance the jawline. I have my jawline Botox as well, and when I don't have it, I feel like it's not as sharp and defined. And so it's basically 10 units along each mandibular side, and sometimes it's more than 10 units, but usually it's 20 units altogether, 10 on each side, and it's called the Nefertiti lift. The Nefertiti lift, so all the muscles in the face and neck are antagonistic, protagonistic. They're all pulling and pushing on one another. And so when you knock out the muscles that pull down, The muscles that pull up go unopposed and contract and have a resting tone that contracts and basically sharpens and defines that jawline and the angle of the jaw too. And it's really beautiful. Sometimes it's pretty subtle, but my patients who come in regularly for their jawline Botox definitely notice a result. And even if it's a small little change, they absolutely love it and they're obsessed, because when their Botox wears off, they're immediately coming back into the office for more. And you know, sometimes it lasts about 3 months, but in the jawline, sometimes it lasts even longer, about 6 months. Now, when I reconstitute my Botox, I do it by the book because I'm a rule follower and that's how I do everything. And, you know, R&D in, you know, the company of Allergan came up with a reconstitution amount based on the migration, the potency, the duration, the effect, and so they came out with the perfect number for us to use, which is, you know, how I reconstitute my Botox. So when you've reconstituted it by the book, the way that you're supposed to, and you're not watering your Botox down like unfortunately some injectors are doing and some med spas are doing, it should last about 3 to 6 months. It gives a beautiful contour. So taking it a step further, other things that we can do to accentuate the jawline. Thermage is one of my favorite treatments, and it enhances your body's own regenerative processes to tighten, lift, and pull that skin. Collagen baking if you're young, reversing and stimulating collagen synthesis if you're more mature, to just sharpen and define that jawline. And when you're enhancing your skin's own ability and own regenerative processes, those results are like next level, you guys. It's better than surgery, nip, tuck, suture, scalpel, all that stuff, because gravity, it's like, you know, and I'm a surgeon too, so I can speak from both seats. And so I feel like when your skin doesn't have collagen in it, and say you have a neck lift or you have a lower facelift, that skin's just gonna fall again. Gravity, unfortunately, is always gonna win. Now, how you combat it is you chock full that skin full of collagen and elastin and extracellular matrix proteins that we lose as we get older that make it saggy, fall, and laxed. So even if you're going to have surgery, or say you don't want surgery, doing things like Thermage will stimulate collagen synthesis. And as surgeons, we say it's like suturing cardboard versus suturing wet tissue paper. Wet tissue paper is just gonna fall apart again. Now, if you have cardboard and you have natural enhanced strength turgor in your skin and you're suturing that together and you're approximating those wound edges, though that surgical result is gonna last longer and look better after surgery if you do happen to have surgery. Now, if you don't wanna go the surgical route, which many of my patients don't, because I'm a non-invasive cosmetic dermatologist for the most part, although I do select surgery still, it's really important to just really define that jawline, and it does such a beautiful natural job and the results last. Now, if you are gonna look online and see mixed reviews on Thermage, like anything else in cosmetic dermatology, it's very operator dependent. People who water down the Botox get dropped lids and results don't last long. People who water down and blend out their fillers are not giving you the true aesthetic correction, and they're watering their product down and you're not getting long lasting results. Same with Thermage. Sometimes, you know, okay, I just switch out the memory card, so sorry for that little intermission. Now, any tightening device is a great option for non-surgical tightening and defining the jawline. Soft wave, Ultherapy. I happen to like Thermage the best because it gives the most consistent results, and I've worked in an office where I had both, you know, in all of these devices, and I saw which room was the busiest, which patients were the happiest from, and which gave the most reproducible, amazing outcomes. And so that's why I have a Thermage in my office. If it makes it into my office, it stood the test of time, and there's reasons why certain devices are in my office and others are not. That's not to say that the other ones aren't good. I just, in my opinion, feel that Thermage is the best. And on the subject of jawline contouring, it does an amazing job of sharpening and defining that jawline. Again, if you're younger, to collagen bank, so as we gain wisdom and have birthdays and age, you stay sharp and defined in that area. And if you're older, to kind of help tighten up that skin without surgery. Now, for people who do need surgery or do want surgery, it's not contraindicated. Thermage definitely makes surgical outcomes last longer and respond better when you're gonna have surgery. Now, you may see other plastic surgeons, everybody has a hidden agenda. I'm being totally forthcoming, and I've worked in offices with plastic surgeons, and oftentimes they would have me Fraxel or Thermage their patients pre and post surgery to have the results last longer, because the skin, and I can speak as a surgeon too, because I'm a surgeon as well, but most of my treatments that I do in the office are minimally invasive and corrective, prejuvenation, rejuvenation without surgery, because that's just my area of expertise. But as a surgeon, I can also say when you're operating on skin that doesn't have a lot of collagen in it, or have a lot of elastin or extracellular matrix proteins that give skin that beautiful smooth contour and turgor, it's like suturing wet toilet paper together. When you're suturing cardboard together, when skin is chock full of these extracellular matrix proteins, those results last longer. Those surgical results stand the test of time, because if you don't have a lot of collagen in your skin and your surgeon's sewing up the skin together that's just wrinkly without a lot of collagen or elastin in it, gravity unfortunately is going to take over and the skin's going to sag. I see it all the time. It's going to sag again. People who have not done anything to increase their collagen stores, they have a neck lift, lower face lift, they look great for a year and then they're right back to where they started at their baseline or pretty close to it. So with or without surgery, Thermage and increasing collagen stores in this area is really important to keep that jawline sharp and to keep that profile and mandibular area sharp and strong and beautiful with beautiful contour. So we've talked about Botox, we've talked about tightening devices, and next we can talk about, well, thread lifts, I'll kind of table that for another video, but thread lifts work really well too. It's basically string light filler, and it helps mechanically pull up on that area to sharpen and define it more. Again, it's very operator dependent, just like Thermage is, just like many of these procedures are. And now that a lot of these med spas and cosmetic procedures are becoming so mainstream, I feel like there's a drop in the quality a little bit on the caliber of the person providing these treatments. So if you see mixed reviews on any of these treatments that I'm talking about, Thermage doesn't work, Thermage, or Ultherapy doesn't work, or threads don't work, or there's complications. It's very operator dependent, and if you're not having someone who is well versed and highly trained in how to perform these procedures, or if you're going to an office where they're cutting corners, and I hate to say it, but offices often do this, whether they're watering down their Botox or blending what they call their fillers, which is basically watering down their fillers, or they're using the same Thermage handpiece, which is intended for one person, and spreading it amongst 3 different people, you're not going to get the outcomes and the results. But I'm here to give it to you straight. I'm here to give it to you without any sponsorships or paid partnerships. I just recommend what I feel is best for my patients. And on the subject of jawline contouring and jawline aesthetics, these are what I feel work the best. And I just wanted to preface it with that information, because if you look online and you see mixed reviews regarding some of these non-surgical options for jawline contouring that I'm discussing, that's probably the reason why. Just like some people have bad experiences with Botox, with dropped lids, with it not lasting as long, probably because our providers or offices are watering down their Botox too much. So it's it's just something that we have to accept that's happening today. And so I feel like empowering my patients and my beauties who follow me will kind of give you a little insight as to what to look for in a provider and how to make sure that you're getting the best treatment options that are by the book and the ones that work the most effectively. So moving on, we've talked about now thread lifts, now neuromodulators, and tightening devices for the jawline. Let's move to fillers, because this is going to probably be one of the most rapidly evolving areas in aesthetics because of all the attention to the jawline, and especially with the launch of Volux this past weekend. So this past weekend, I was part of the Allergan Medical Institute, which we call AMI, where experts train the experts on how to use this new product. So we were trained by international doctors who have already been using this product, where it has already been cleared in their area of practice in other countries, and to shed insight on us as providers. We had like a cadaver lab where we were injecting cadavers with colored material so we could see exactly what dermal planes we were going in, where it was going, what it was doing, and on live patient demonstrations, and they let us play with the product. We had a lot of education on the product, and it's really going to be an exciting new injectable to help maintain that jawline contour and to really provide beautiful jawline contour to people who have maybe aged and lost their jawline, or just want a little anatomic Okay, so that time my battery ran out. I'm such a mess. Okay, so I had my battery run out, my memory card die, and my camera's probably gonna overheat next. Okay, so let's just get through this. Volux is the new hyaluronic acid filler that was FDA approved for jawline aesthetics and jawline rejuvenation or prejuvenation. And it has a very high G prime. It has a very high cohesivity, and it's different than Voluma, which we've been using off-label for jawline contouring and having amazing results with, but it's different than Voluma in the way that it behaves as it's injected. The cohesivity and the G prime is different. The G prime is actually much higher than Voluma, and if this is getting too scientific for non-injectors or patients who are watching this, it's very thick. It's a very thick filler that doesn't behave the way Voluma does, which is usually the filler that we use to inject inject over bone for the zygomatic arch of the cheeks to help lift up on the face, and previously for non-surgical chin augmentation. Voluma can still be used in conjunction with Volux, and if there's other similar hyaluronic acid fillers that are in the same space, I mean, Volux is the first of its kind, and I'm sure that other companies are gonna, mimic it or maybe come out of their own version of it. But basically, it's a very thick filler that is amazing at improving the jawline contour with immediate results, long-lasting results. I think the results last at least 2+ years. And just seeing these demonstrations over the weekend and injecting it myself, I'm really impressed with this product and what it can do for the jawline. Now, it can be used in conjunction with Voluma and other treatments as well, but just in and of itself, I couldn't believe the outcomes that we were achieving just with one syringe of this product. Now, me as an injector, I'm more conservative. Their injector is doing 2 syringes of Volux on each side. Of course, even if I feel a patient needs that correction, I never really do it that much in one setting. If you're a patient of mine, you know I'm more conservative because slow and steady wins the race, and I feel like successive approximations to the goal makes you look more natural with more natural results without a huge jump in improvement right away, more of like a gradual improvement. But I was amazed at the outcomes that we could achieve with this product. I'm super excited for the launch of it, and I'll definitely do like a live demo or post it on my story or on my Instagram as well. But just moving to fillers, what role do they place in jawline contouring? So when you're looking at the jaw, it's important to go 180-degree view. You don't just look at the jawline from the side or from a frontal view or from an oblique view. You have to correct the entire area, whether it's lengthening the jaw for somebody who has a hypoplastic chin, whether it's defining out that angle of the mandible that may be lost by bone resorption. It may be just correcting this mid maxillary area here that has kind of become a little atrophic over time and the skin there is sagging. Every patient is different. Everyone's anatomy is different. Everyone's different with respect to how the aging process is taking a toll on this area. So you have to correct accordingly. It may be a little bit of Volux in the mandibular angle right here. It may be just kind of elongation of the chin for somebody who feels like they have a shorter 1/3 of the face, or it may be in conjunction with Voluma that helps contour out that chin. And they all work beautifully and blend very well together, and I'm really excited for this new frontier of jawline aesthetics and what we can do for our patients, especially because so many of my beauties are coming in asking for these treatments. So actually, I'm going to refer to my notes because I took notes during the meeting on my phone, and I want to make sure that I'm like not missing anything. So just this is straight from the meeting. So I'm in the section where they're talking about the new technologies, which I'll do another video of later, but that's super exciting too. And the thing with Allergan as a company is they invest in research and development and clinical studies to gain FDA approval, so that the reason why they do that is to provide injectors with increase, and I'm not paid by Allergan, I'm not like a paid sponsorship or anything, I really think that this is interesting and it's really important to propagate correct information. The reason why they do FDA approval for a lot of these procedures, because a lot of injectables that we use are off-label. And the problem with that is that there's no clinical trials or data to show us the correct ways that these need to be done, and then we can't hold instruction on training new trainers and provide training sessions for people if it's not FDA approved. So I think that that's really responsible as a company that they do that. And I serve on the Allergan Medical Institute, where I train other injectors, and I really feel good about doing that because you need to have the right and appropriate training for safety and for the best outcomes possible. Another interesting point that they mentioned is when the eyes scan the face, the brain perceives certain things as old, young, sick, healthy. We talk about this a lot when we talk about the temples. People who have what we call peanut head, which I hate using that term, but my attendings used to say that all the time. People who have temporal wasting and have like an indent here will look aged or sickly, even if they're young. Like say that they're really lean, they're working out, they're training for a marathon, and they start to get sunken here, it'll age you. Your body looks amazing, but your face looks like 10 years older. So doing a little bit of filler here can kind of help rejuvenate the face and just give an overall very youthful, healthy appearance. Same with the jawline. When the eyes scan a face, the first thing that the eyes go to is the lower face, because if the jawline isn't tight, if it's not snatched, and if there's loose skin here, that'll give away our age or make us look older. Even if we're as early as our 30s or 40s, these little changes start to happen. So I feel like that's why it's receiving a lot of attention now, especially with masks being not, well, I guess for right now, masks not being implemented anymore. It's bringing patients in, and this is what people are asking for. So based on aesthetics, the way that eyes perceive and the brain perceives the facial thirds, in aesthetics we always talk about the rule of thirds. There should be a third, a third, a third when you're looking at the face, and when the lower third of the face is shortened or it's just off in some way, just kind of rounding it out and making everything in harmony can really have a dramatic difference on, making you look your very, very best. So that's my take home for jawline, and I will continue to post these new treatments and implementation of different various treatments kind of blended together, and we'll keep you guys in the know as always. So I'll drop content every Sunday. Be sure to hit the bell and subscribe, and I love you guys. And I just got off the plane from this conference, so I'm gonna go get out of my scrubs and go take a really long, relaxing shower. All right, love you guys. Hi, my beauties. I have to crouch down to get into the view here in this camera, and I'm doing this on my iPhone. But I was doing a Kybella case just now, and I'm like, oh my gosh, I just filmed a YouTube video yesterday about jawline aesthetics, and I forgot one key component of one of our tools in our toolbox that we can use to make the jawline look better, and that's Kybella. So these videos aren't going to match because yesterday I was at home with my Nikon camera, and the lighting and setup was more professional and higher end, and now I'm just in the middle of the back of my clinic on my iPhone posting this video, but it's content and it's just comprehensive, and I wanted to be all inclusive of other treatments that we use and other tools in our toolbox that we have to improve the jawline. So Kybella is deoxycholic acid. It's an injectable fat dissolving solution. We use it to melt fat on all areas of the body, especially stubborn areas like back fat, bra fat, like the lower abdomen, that stubborn little patch of fat that doesn't go away no matter how much you diet and exercise. But we also use it for slimming the jawline and for improving the contour of the jawline, especially if there's some fullness in this area. I hate to use the word double chin, but for a double chin, it helps melt it away. Anywhere from 1 to 3 treatments needed, usually spaced about 6 to 8 weeks apart, gives the most beautiful aesthetic outcome, and it really helps to add to our, a tool in our toolbox to really rejuvenate or even improve the cosmetic appearance of the jawline by getting rid of that little submental fat or fullness in that lower face that can make our jawline more sharp and can make the chin, more prominent in a good way, and just can give a beautiful aesthetic result. So combining, the things that I had already mentioned in the video, jawline fillers, tightening devices, thread lifts for jawline if needed, and definitely we're about to launch the new product Volux by Allergan, and using Volux and Voluma to help accentuate the chin, and adding in some Kybella there. That's what you need. So non-surgical options, which actually sometimes have better than surgical options for jawline contouring and chin. So you don't need a chin implant unless it's really severe, or unless you're willing to go through, the surgical procedure, which as dermatologists and aesthetic injectors, oftentimes patients who come to see us end up not needing the chin implant that they thought they needed, because we can do so much with injectables with the technology that we have today. All right, so now I'm for sure done. Okay, love you guys.